So we've got 5,286 new cases, including 3,681 positive rats. Tragically, we have to report today that 10 people have lost their lives, and once again we express our condolences to the families. It's a very tough time for these families, and I understand that and appreciate that, and I express my condolences on behalf of the people of this state. Our numbers in public hospital seem to be coming down, 462. There are currently 35 people in ICU, 16 are ventilated. That number is coming down. Our vaccine coverage, 92.37% first dose and 90.33% double dose. 61.53% of eligible population have received their boosters. We really do need people to come and get their boosters. Can I just please add a big shout out to please come and do that. The number of our rats distributed has gone up. It's in excess of 4.1 million, which is great to see. And our 5 to 11-year-olds is 41.19% of eligible children. So that's great news as well. So I'll hand over to our Chief Health Officer. Thank you.
Thank you very much, Premier. So sadly, we have 10 deaths to report today. As we've said on a number of occasions, these are people who have died who have had a recently positive COVID-19 test. Whether or not the cause of the death was due to the virus or not, we don't necessarily make that distinction. So there were 3 people in their 60s, 3 in their 70s, 1 in their 80s, and 3 in their 90s. Of these 10, 1 of these had received only 1 dose of vaccines, 6 had received 2 doses of vaccine, and 6 had received boosters. On this occasion, there were no aged care residents in this group. Our thoughts again with their families. The situation in hospitals continues to improve. We've fallen to 462 people in our public hospitals from 484 yesterday, and we would expect that to continue to fall as the week progresses. The numbers of patients in intensive care units have also falling. We're down to 34 patients from 40 yesterday. 16 of the intensive care patients are currently ventilated, and as I've said previously, the patient falls in the number of patients in intensive care is often the last thing that occurs in terms of the hospitals. In our private hospitals, we have 29 patients with COVID. That's down from 30 yesterday. There's been a slight increase in the number of positive cases in school children. We're reporting 1,587 positive cases in children between the ages of 5 and 17 today. That's up from 963. It's up from 963 yesterday. I wouldn't read too much into a single. I'll start again. We are reporting 1,587 children between the ages of 5 and 17 positive today. That's up somewhat from yesterday when we had a report of 963, but I wouldn't read too much into a single day's reading. Interestingly, we've been looking at New South Wales experience, which is a week ahead of us in terms of schools returning, and they've only seen a very slight blip in the number of increased cases on return to school. But it will be interesting to see what will happen during the course of this week in terms of children with COVID-19. But again, I must emphasise, all or almost all of these children have mild symptoms. We don't have any significant rises in children in hospital with COVID at present. I'll hand back to the... Go ahead.
That's a little bit of a spike in the overall number of cases. Is that to be expected given Sunday?
Yes, it probably is. It probably just in terms of the number of tests that were performed, fewer tests performed on a Sunday. Again, I wouldn't read too much into that either. I think we need to see trends, not individual days. It's sort of better to look at like a 7-day rolling average, and numbers are clearly coming down, very confidently coming down.
Dr. Gerrard, with the daily press conference, is it a certain number you think will reach whereby we no longer need to have them, or is it a time? What are you aiming for? I guess it's probably not your decision as to daily press conference, but what do you think is the metric that we should be measuring to see when it's necessary?
Again, it isn't really my decision. It's what the people of Queensland want, I guess, ultimately will be the deciders for that. And obviously, if we have important announcements to make, we would like to have conferences there. We are currently looking at all of the restrictions that we have in place in Queensland. All of them are currently under review, given that this Omicron wave is coming to an end. So we're also working with our interstate colleagues as well to see what they are doing as this wave comes to an end. Go ahead.
Would it be based on numbers, or
we've always said we'd have a look. We've always said we'd have a look at these measures at the end of this month, and we're sort of halfway through February now. So towards the end of this month, we'll be looking at them, and then we'll make a call then, and also see what other states are doing as well.
Does that include the vaccine mandate also?
We'll look at it. We're looking at everything.
Do you consider ramping these restrictions back up if you see a new variant?
Absolutely. So if we, I mean, this is, again, we're getting speculative here. If some of these restrictions were to be withdrawn, if they were, such as masks, then that would be purely on the understanding that if there was a resurgence of infection, then masks would be reintroduced, say, if that would happen in the winter. But again, this is speculative, so I don't want to go too much into that. But that would always be the understanding.
Masks and vaccine mandate, would they likely come off together, or do you think it's staged?
Let's see what happens. We're reviewing all of this at the moment. I think we probably shouldn't speculate further.
When do you expect a decision on that?
Say again, sorry?
Because the government's been reviewing it all the time. When do you expect a decision on those things?
As I said, towards the end of this month. We're looking at it now. Any decision will be as we go towards the end of February, which is when we expect the wave to effectively come to an end. Now we'll still see cases. The virus isn't going to go away. We're still going to see transmission of the virus heading into winter, but clearly the numbers are continuing to fall.
Rats being provided to schools, is there any thought to extend that out to childcare centres also?
This is not something we've considered at present. I mean, this is something we can meet with the sector if this is an issue. I know there have been some discussion about this in the sector, but it's not something we've looked at until now, no.
Any benefit to testing children at that age?
It's just not something we've actually been considered or asked about. So I don't want to, again, don't want to speculate.
If the sector did come to you and say, we think that the merit, more so for the staff than the students or the kids themselves?
No, I think I need time to think about this and discuss it with them. We just have not considered this or discussed this.
Dr. Gerrard, childcare centres have closed rooms or a whole sector due to Omicron surge.
Yeah.
They're wanting to be declared as like critically essential.
Yeah.
Would you consider making that?
I mean, it is a fine balance. When we talk about critically essential workers, we're talking about people who will be allowed to go back to work if they've been close contact. But we're happy to discuss this with the sector. Thank you.
On that question, the state government is distributing rats to schools.
Yes.
Why not childcare?
As I said, and as Dr. Gerrard said, we're happy to talk to the sector about that. Minister Grace can organise that, and as we do all the time, we do consultations. So, if there is a desperate need, I'm quite sure that we can put additional rats out there. Thank you very much. Thank you. In relation to that question about daily press conferences, I think the public still want to know how we're going with this wave. So at least until the end of this month, just to give reassurance to Queenslanders that we have come off this peak. So that would be our intention as a government, and also with the reviewing of restrictions. And then after that, it would be as needed or as required. So we do want to keep the public informed. I think they want to be kept informed as well. From my conversations I have, it is still a topic of concern out there in the community, and we will be keeping Queenslanders up to date.
And on the mandate, the mask issue, at the end of the month, will you also be able to give some sort of clarity on another month, or is it just going to be a rolling review type?
Yeah, look, definitely. We always review our any restrictions at the end of each month. And as Dr. Gerrard said, we'll be coming into winter. But Queenslanders have done a terrific job, and you've seen some of those stats that have been released. It has been a lot better than we were anticipating. And let me say, not as many sleepless nights as was during the start of this wave when we saw the expectation of those really high numbers. So coming off the wave is absolutely good news, and the numbers coming down in our public hospitals and also in ICU is also encouraging news, and the fact that we haven't seen a really large escalation of children in primary schools.
So at the end of the month, do you think you'll say we need one more month?
Oh, look, we'll make an announcement at the end of the month, as Dr. Gerrard said, that these restrictions are being reviewed. We'll take his advice. Government always listens to the health advice and see what he has to say too.